Hi, everyone. I'm Robert F. Kennedy Jr., your HHS secretary. The CDC was once the world's most trusted guardian of public health. Its mission was simple and noble: protect Americans from infectious disease. But over the years, the agency drifted. Bureaucracy, politicized science, and mission creep corroded that mission and squandered the public trust. We saw the consequences of putting dogma before science during the prolonged COVID mandates of the Biden era. Cloth masks on toddlers, 6-foot distancing with no scientific basis, boosters for healthy children, lockdowns that wrecked our economy, and the suppression of low-cost therapeutics in favor of experimental drugs that were ineffective. The CDC implemented a school lockdown policy that was written by the teachers' union and sold to the public as science. This was the template for the politicization of science that became pervasive across the agency as the agency put politics ahead of evidence-based medicine. The toll was devastating not just for our children, but to public health. America has just 4.2% of the world's population, yet we suffer nearly 19% of the world's COVID deaths. We literally did worse than any other country in the world. That failure was no anomaly. For years, the CDC has presided over rising chronic disease and declining life expectancy. Trust has collapsed. Only a tiny fraction of healthcare workers and parents now follow CDC guidance. President Trump has asked me to restore that trust and return the CDC to its core mission. We've already shown what a focused CDC can achieve. When measles flared up this year in Texas, we surged vaccines and therapeutics and staff to the outbreak's epicenter. The outbreak ended very quickly. That response was not pro-vax or anti-vax. It wasn't ideological. It was effective. And effectiveness will be the watchword of our leadership. We also know that chronic disease made COVID especially lethal in America. Infectious and chronic illnesses are connected. The very tools we use, vaccines, antibiotics, therapeutics, save lives, but they can also cause harm for some patients. That truth can no longer be ignored. The path forward is clear. Restore the CDC's focus on infectious disease, invest in innovation, and rebuild trust through transparency and by restoring competence. To achieve this, the CDC will protect against threats with advanced detection tools, strengthen infrastructure at home and abroad, modernize data in labs, rebuild the workforce of disease detectives, and apply gold standard science to every recommendation. And we're going to empower states and communities on the front lines. We've already shaken up the leadership and removed conflicts of interest. The American people elected President Trump, not bureaucrats, to set health policy. That's the MAHA commitment in action. Most CDC staff are honest public servants who are trying hard to accomplish their jobs. With this renewed mission, they can do their jobs without politics or fear. Together, we will rebuild CDC so that it will once again be the world's most trusted authority on infectious disease. Thank you.
Produced by the U.S. Department of Health and Human Services.